Hi, looking at the situation of local services with regards to what will be quite a traumatic time for everyone, particularly those in NHS trying to do the best they can with the service that they've got. I had the opportunity to have a quick chat with one of the partners at the Grove Medical Centre, and we did ask him to come on camera and update you through us, and I think because the situation and the advice that's coming down the track is very fluid and sort of changing, he thought it wouldn't be appropriate for him to do that at this time until it's really rather sure exactly what you should be doing. But what he did say is that our surgeries and the staff in them are ready. I actually visited the surgery last week, and it was very much the calm before the storm. It was like the phony war, and getting everything ready where you could, getting the staff ready, making sure people were socially distancing themselves to ensure the rate of infection slows where it possibly can be. I think we will all be reliant upon each other to actually take the advice that's coming down the track, even if it's a little late, and do the best we can. Now, to that end, Felixstowe, the Town Council and others have put together an organisation called the Felixstowe Helping Hands. This will be added within this video. It's actually, if you are a member or have in your household, you're self-isolating, you're over 70 years of age, or you've actually got an existing health problem, they are going, as it says, Helping Hands, or help with shopping, help and do whatever they can to help vulnerable folk and other folk through this phase. Now, on Sunday at the Andrew Marr show, Dr. Addison, I think she was at St George's Hospital, said she's got grave concerns in 3 areas. Protection for her staff is short supply and apparently of a very basic type. She was very worried about folks self-isolating in that the rate of testing isn't necessarily showing whether it's necessary for them to be doing that or not. So what she is finding is members of her staff are having to be away for a whole of 2 weeks just in case. Now, there are tests that need to be done much quicker, so that those staff who have not been impacted or infected are able to return to work and support the system much quicker than they're currently able to do. And her final bit, and this was from a London perspective, what she was saying was her staff are travelling using public transport, the tube, buses, etc., which actually makes her staff a ready source of infecting the general population as things are. Her staff aren't able or cannot afford taxis, etc. So what she seems to be saying, and was saying, was that there needs to be a deal more effort made across all systems, but particularly at the leading edge of this, which is London, Birmingham and other big cities and wherever. Now, in case you're hoping that a vaccine will be turning up anytime soon, Dr. Ryan, who is the WHO's lead authority on this matter, said that with the best will in the world, he didn't actually see a vaccine coming for within at least a year. So what we've got to do is what we could do ourselves, and that's to stay safe and stay home.